Hi, everybody, and welcome to another edition of Tea with Dave. And today, I'm really happy that I have a special guest, Lyne Gillespie from Ottawa Public Health. And yes, like I mentioned, I'm Dave. So welcome, Lyne.
Thank you, Dave. I've got my tea.
Yay! So what are you drinking there?
I'm drinking just regular, boring tea.
Okay, awesome. I
don't even know what kind it is, Dave, because I never drink tea.
Okay, no worries. I've got my Irish breakfast today. You know, giving tradition to my roots. So
Perfect.
yeah. We want to talk about aging and also physical activity. Recreation, and what does that look like during a pandemic in these times. So a word we've heard a lot about is the concept of social distancing, or physical distancing is the official term. Can you demystify that? What does it mean, and what does that look like?
Yeah, so I mean, Ottawa Public Health is recommending that people practice physical distancing. And the reason for that, because we've been hearing that now for a couple of months, right? And we tend to forget why we're doing it. But basically, it's to reduce the transmission of the COVID-19 virus. And basically, what it means is to actually make a distance between yourself and others. And basically, when we're talking specifically about COVID-19, we're talking about a distance of 2 meters or 6 feet.
What are some of the things that you can do to sort of stay connected?
Yeah, so there's we want to encourage people to stay connected, especially, there's a lot of older adults that are self-isolating by themselves. So it's important to have some connectedness with others. And some ways to do that is just speaking on the telephone, which sometimes is a bit of a lost art. But in these times, I know I've reconnected with many friends just by talking on the phone, which is wonderful. You can also have video chats, just like you and I are doing right now, Dave, and also just using social media and digital applications. There's a variety of them where you can even play virtual games with others, which has been great. So there's really a way to stay in touch. It is super important to stay physically active during these self-isolation, physical distancing periods. It's also important to get fresh air. And, if you're walking on the sidewalk and you need to pass somebody on the sidewalk or on a path that you're walking on, there is no danger. There's no risk of COVID-19 transmission by passing someone while you're walking. So you take an extra step sideways and you just go around them and keep going. If you're moving more quickly, i.e. you're running or you're biking, then, and there's someone in front of you, just make sure you keep a good physical distance. Again, we're looking at that 6 feet, 2 meters distance, and it's great. And that way you're getting some physical activity. You're seeing people, you're seeing beautiful surroundings. Hopefully the weather will continue to improve. And it's just really good for you to get out there.
Absolutely. And that's a good cue that I'm going to leave a lot of resources in the description of this video on our YouTube channel. So if you want more information, how to get information from Ottawa Public Health or get connected to the Facebook page that Lyne was mentioning, we can do both of those things. So those recommendations are fantastic, but there are some restrictions within that, right? So we hear that, older adults are at risk, but there's really some age groups that are more at risk than others.
Yeah, exactly. There is the Ontario's Chief Medical Officer Health strongly recommends that people over 70 years of age should self-isolate because we know that COVID-19, there is an increased risk with older adults, so people over 70, but also with people with other chronic diseases such as diabetes, cancer, renal problems, pulmonary problems, heart problems, and also people that have an immunocompromised immune system or immunodeficiency. So for sure, for those groups, self-isolation is key, and physical distancing is also key. And we do recommend that for those groups, if you need, you're going to need essential items, you're going to need groceries, you're going to need prescriptions. Please ask your friends, your neighbors, your family members to help you. They can get that for you. You can make a list for them. They can drop it off at your door. And that way you're minimizing your contact with a whole bunch of people by not going out yourself.
Yeah, why don't you tell us about your Facebook page? Because I hear that's Aging in Ottawa is a great thing, and it's fairly new.
We launched it 2.5 weeks ago, actually. It's called Aging Well in Ottawa. It's monitored by public health nurses from Ottawa Public Health on a daily basis. So we respond to questions. And there's been some great conversations between the people, the followers, since its beginning. It's for people that are 55 plus and caregivers. And so we try and stream all our posts and our information for that age group and for caregivers. And it's a variety of topic, but all tied in to COVID-19. Where people can go and get more information. And there's a great way to also connect with other people, and they have conversations. So it's really kind of cool.
Very neat. Well, I want to thank you very much, Lynn, for your time today, speaking to us. And thank you, frontline staff. And it's nice to talk to another, department within the city of Ottawa. And then I'm going to do our selfless plug. Be sure to, like our page, like Lynn's page. And yeah, this is just another way to reach out and sort of reach our Ottawa residents, right, with information and helpful tips and resources. So thank you very much.
Thank you, Dave.
Have a good day.
You too.